Hi everyone, a very warm welcome and a very good evening to everyone who is joining us on Facebook Live tonight. Thank you very much for tuning in with us. My name is Trijin. I'm the fourth year medical student from University of Malaya, and together with me also Priyanka.
Hello everyone, my name is Priyanka. I'm a second year medical student from University Malaya.
Yeah, so both of us will be the moderator for tonight's session. Yeah, so tonight we will bring you the 8th episode of our widely popular series, Meet the Specialist. And in this episode, we will be speaking to Professor Dr. Ahmad Hatim bin Sulaiman, who is the head of Department of Psychological Medicine from Faculty of Medicine, University of Malaya. And Professor Hatim did his master and PhD program in University of Malaya. He's also the active president of Malaysian Psychiatry Association and the chairperson for National Conjoint Board for Postgraduate Psychiatry Training, as well as the council member of the Asian College of Neuropsychopharmacology. So you are most welcome to like, react, and share this live video out to your friends and family and get everyone on board. We will be waiting for another few minutes and we'll start shortly. In the meantime, you are also welcome to follow us on our social media, our Facebook, Instagram. And if you're a medical student and haven't subscribed to our mailing list, feel free to scan the QR code on the screen and to keep yourself updated in the happenings of our society. Yeah. So we'll be starting shortly and just sit back and relax first. Thank you. Hi everyone, a very good evening to everyone, and thank you so much for joining us in this Friday night today. I'm Trijin and a fourth year medical student from University of Malaya, and together with me we have Priyanka.
Hello everyone, my name is Priyanka, a second year medical student from UM.
Yeah, so both of us will be the moderator for tonight's session. So tonight, MEDSOC brings you the 8th episode of our widely popular series, Meet the Specialist. And in this episode, we'll be speaking to Professor Dr. Ahmad Hatim bin Sulaiman, who is the head of Department of Psychological Medicine from Faculty of Medicine, University of Malaya. Prof. Hatim did his master and PhD program in University of Malaya, and he's also the active president of Malaysian Psychiatry Association and the chairperson for National Conjoint Board for Postgraduate Psychiatry Training, as well as the council member of the Asian College of Neuropsychopharmacology. So without further ado, let us invite Prof. Hatim on board to share with us about his experience in this field of psychiatry. Yeah, so let's welcome Prof. Hi, Prof. Hatim. How are you? Thank you so much for joining us tonight. Yeah. How are you feeling today, Prof?
Very good. Very good.
Yeah.
Thank you. Can
Glad
you
to hear
hear
that.
me? Can you hear
Yeah,
me?
we can. Yeah, we can hear you clearly, Prof. So I think perhaps we can start with like, Prof, can you share with us, why did you choose psychiatry as your choice of specialty?
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good evening. Thank you very much, Eugene and Priyanka, for hosting the session, and thank you to MEDSOC for inviting me for this session. It's a great pleasure to be here tonight, and thank you to all the audience for sharing your precious time with us. I'm very honored to be here. So why do I choose to become a psychiatrist? I've always been intrigued and interested to know about human mind and their behavior. So actually, I first fell in love in psychiatry during my MBBS posting, during my medical student. I graduated from UM as well. And I find psychiatry very interesting. Very interesting and easy to understand. So I also had very good experience during the posting and enjoyed the posting very much. I found that the lecturer, the staff, and even the patients are very, very cooperative and very nice. So since then, I decided that, okay, psychiatry is for me. It's just like love at first sight, So after graduation, I actually never did any psychiatry posting. After housemanship, during my time, there's no psychiatry posting. Yeah? And now you have psychiatry posting as a 6 posting during housemanship. And during my time, I only had 4 posting. I never had any psychiatry posting. I was anesthesia MO for 1 year. And then after that, I straight away applied to join psychiatry masters in UM. And alhamdulillah, I was accepted. And here I am now for the past 20 years.
Okay. Yeah. Thank you very much for sharing your reason with us. I myself also find psychiatry is actually very enjoyable posting. Yeah. So I think we can move on to can tell us more about what does a psychiatrist do?
Okay, what does a psychiatrist do? So psychiatry is basically a physician, a doctor who specializes in, of course, psychiatry. So this is a branch of medicine that devoted to the diagnosis, prevention, and treatment of mental disorders. Okay, so mental disorders is actually very broad. So it can be divided into mood disorders, which examples disorders of emotion, major depressive disorder, bipolar, mood disorder. So other mental disorders include anxiety disorders like generalized anxiety disorder, panic disorder, social phobia. There's also eating disorders like anorexia nervosa, bulimia nervosa. So it's actually very broad, not just schizophrenia or delusional disorder and all psychotic illness. Even addiction disorders like drug addiction, internet addiction, gambling, it's all under psychiatry. Psychosexual disorders, erectile dysfunction, premature ejaculation, is also under psychiatry. Personality disorders like antisocial personality disorder, borderline personality disorders, these are all under psychiatry's care and diagnosis. Okay. So psychiatrists usually work in a team which includes multidisciplinary team involving other specialties as well, but more so with the clinical psychologists. So there's people always mix up between psychiatrists and clinical psychologists. So psychiatrists, to be a psychiatrist, you must be a medical doctor first, then you take a master's degree or subspecialty in psychiatry. But clinical psychologist is not a doctor. So they learn psychology, which is different from psychiatry. So psychiatry or psychological medicine in certain areas they call it. So we also work with social worker, occupational therapists, and of course the nursing staff. So being a psychiatrist, there's that's never boring. The same thing. There's a lot of variety in the day. Okay, so basically what we do, we see patients outpatient, inpatient, even though the diagnosis will be the same. Examples: the major depressive disorder. The presentation is always the same: low mood, anhedonia, poor appetite, poor sleep. But the story behind it is always different. So it's just like watching a movie. Of course, we are not enjoying other people's suffering, you know, but it's always different, you know. So the story, the why they develop psychiatric illness, the stressor that they have, the problems, there's always different from one patient to each patient, and we always learn from this experience. You know, we learn from our patients, and psychiatrists are seeing and treating patients in a more holistic way, not just looking at pathology and physiology. So it's more personalized. Okay? So you are looking at the patient in a more complex cause of their illness. Okay? Or you're not just looking at the fractured bone or at the tumor or at the infection, you know. So you're looking the patient at a different angle, various aspect of their life. And when we treat the patient also, we look at various aspects of their life and various angle on how to solve and help the patient to recover. So yeah, so that's basically about psychiatry. So if it's, you can always ask me again if it's too, what I say is too circumstantial or too over inclusive. Okay.
Prof, what would you say are some traits that are needed in specialty, or what are some traits that makes someone a good psychiatrist?
What are the traits? Okay, what are the traits? What are the traits that make one a good psychiatrist? Okay, basically it's quite easy to become a psychiatrist. You know, it's not, you don't have to have a special, very special talent. I think anybody can become a psychiatrist. But what makes a good psychiatrist? Okay, first you must have a good listening skill. Okay, because basically psychiatrist listens to people's problem, listens to people's issue. Okay, so you have to be good in listening. Probably less talking, even though tonight I'm doing a lot of talking, but normally I listen a lot. I just ask one open-ended question and let my patient talk. You know, so you must be good in listening, and you must have good observation skill as well. You must observe the patient's the behavior, you know, the body language, the facial expression, you know, what are the features that they have. So you must be sharp in picking all this. So good listening and observation skills are important. But if you are not good, then you can always practice. Yeah? Over time, you can pick these skills up. Not necessarily that you're born with it. You can always learn the skill, listening skill, observation skill. You can learn. It's not something that is inherited. Okay. Another important traits is you must be empathy. You must be empathy towards others. You must be able to view other people's emotion and feeling from their perspective. It's not sympathy, empathy. So empathy is very important in psychiatry. Ability to see other people's problem, other people's emotions. And you must be willing to spend a lot of time, because psychiatry, we spend a lot of time with our patient. So especially when new patient diagnosis, we take a lot of history. So history taking, mental state examination, we need to spend a lot of time with the patient, and we have to do a lot of educating the patient as well. Educating the patients, the family, about the diagnosis, about the treatment. So all this require a lot of time. So you must be willing to spend time with the patients, with the family. So just like other specialty, you must have a good knowledge. Then you need to learn. So you have to read a lot. You have to learn. And another important traits that I personally think you must have is you must be humble, professionally and personally. Okay, So if you are able to be humble to your patients, to your colleagues, to the society, to your patient, then you become a good psychiatrist. These are some of the, I think, important traits that you need to have. Yeah.
Thank you so much for that, Prof. Could you share with us some of the difficulties or barriers that you face on a daily basis when treating patients? For instance, having to deal with difficult patients or having to consult family members of the patients as they struggle to accept and live with your patient's condition as a family member.
Okay. Yeah, that's actually psychiatry. We have a lot of challenges. There's a lot of challenges that are, of course, different from other specialty. First of all, is the misconception about mental illness. So, mental illness is highly stigmatized, and there's a lot of misconception about mental illness among the general public, even among the healthcare professionals themselves. So people always thought mental illness is due to you all have weak personality, you know. So mental illness can be cured without treatment, or it's due to probably poor faith in religion, you know. So they say, oh, you have depression because you never pray hard enough, you know. Or when they say tak bersyukur, you know, you never read the Quran properly. So there's a lot of wrong misconception, or worse still, people associate mental illness with black magic, okay, with devils, with shaitan, jinn, you know. And I always tell them, you know, so in Islam, during Ramadan, the Prophet say all the devil are chained, you know. So by right, if mental illness due to shaitan and jinn, all psychiatric illness should be cured during Ramadan, but unfortunately, it's not the case, you know. So again, a lot of this belief is still very, very rampant among the general public. So they don't come early enough for treatment. So they go to start first, they go to media, they go to BOMO. After BOMO failure or start failure, treatment resistant cases, then only they come to see psychiatrist. So I think that's a huge challenge to correct this misconception about psychiatric illness. There's also stigma. There's stigma towards patient with mental illness. A lot of people scared to seek help for psychiatrists because people always associated psychiatrists with being crazy, you know, being cuckoo. So seeing psychiatrist, if you see Prof Hatim, that means something is, you know, something wrong up there, you know. So actually, it's not the case. Okay, the psychiatry I mentioned earlier, psychiatric illness is huge, wide variety. You can have like due to stress-related anxiety, can be due to adjustment disorder, can be due to depression. You know, it's not just schizophrenia or psychotic illness, and people always see psychiatrists as a form of weakness. Okay, they don't see psychiatrists as a chronic illness. People are not ashamed to have diabetes. Okay, so people are not ashamed to have COVID. People are not ashamed to have asthma. But the moment you say, "Oh, you have psychiatric illness," people straight away will be ashamed of that. You know, so you have to tell or educate the public that mental illness is also just like other physical illness. Unfortunately, the stigma is still very, 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 very high now. But it's improving, but we still have to do a lot of work to improve this. Okay, other challenges is that the number of cases are getting more and more now. If you read the National Morbidity and Mortality Study, in 1996, the prevalence of Malaysian with mental health issues is probably around 10%. And then they did it in 2006, 10 years later, it's about 12%. But in 2016, it rises to twofold, you know, it becomes about 29%. So 1/3 of adults in Malaysia probably have some psychiatric or mental health related issues. So that's very, very high. You know? That's very, very high. And this is associated with a lot of stress, unemployment, economic problems. Now with the pandemic, very competitive lifestyle, poverty. So there's a lot of factors that really leads to increase or doubling the issues of mental illness. And what makes it worse is that the number of psychiatrists in Malaysia is still very low. We only have around 450 psychiatrists in Malaysia with about 33 million population. So that is 1 to almost 75,000. 1 to 75,000. So each psychiatrist has to cover about 75,000 population, which is really, really huge number. The WHO recommended 1 to 10,000. So it's still very, very low in terms of ratio. So we really need more psychiatrists in Malaysia. So other issues about psychiatry is that psychiatry normally we have a very strong doctor-patient relationship. So sometimes the patient share with you a lot of things that they sometimes do not share with even their spouse, their parents, their family. So it's very secret things that they share with the psychiatrist. And the psychiatrists have to really guard this trust, this information. And because of that, sometimes there's a lot of healthcare professionals who seek psychiatric help. And because of that, you are bound to the doctor-patient relationship and the boundaries of keeping information, confidentiality. So we cannot just simply discuss about our patient. Sometimes you are a surgeon, you go back home and say, oh, actually today I see a very huge tumor, and talk about your patient. But psychiatrists cannot. I cannot say, oh yeah, today I see Priyanka and discuss about the problems. So we cannot simply share our patients. So we have to be very secret and very careful with who we share our problems, because these are very confidential things. And even among the psychiatrists, we cannot share without the patient's consent. Okay, so these are things that sometimes be challenging to psychiatrists. And I think I just want to touch. This is not common, but psychiatrists do work with sometimes physically dangerous situation, some aggressive and violent behavior patient. But you will be taught on how to handle this situation in psychiatric emergency, how to de-escalate, how to be safe with patient. But there's still a risk when patient. But I think psychiatrists, the risk is not so much compared to nurses or medical assistants who are more frontliners than psychiatrists. But there's still physical danger in working in psychiatry when patients become aggressive. So these are some of the challenges that probably you don't see if you are a surgeon or pediatrician or pathologist.
Thank you so much for sharing with us, Prof. I think one of the things that you highlighted earlier, which is actually the stigma surrounding those with mental health, and up to today, it's actually still very rampant. But hopefully, with time and efforts of so many organizations, that stigma can be broken, and people would take mental health issues as seriously as they take physical health issues, and it will not be something that people should be ashamed of. And I think everyone here is curious, Prof. How are you able to juggle between your clinical work while still being able to teach and participate in research? Could you tell us more about this, Prof?
Okay. So this about research, teaching, and clinical work is only particularly applicable if you join the university. Okay. So psychiatrists can work in Ministry of Health, you can work in Ministry of Education, you can work in private sector, you can work with the army. Actually, there's a huge range of variety you can join. But if you join the university like me or the lecturer, so you have your KPI is different. So we have to see patients because we are a teaching hospital. So we have to serve patients. So at the same time, a teaching hospital, you have to teach medical students. We have to teach master students, PhD students. And for us to excel further, you have to do research. That's also a compulsory. So normally, our KPI is about 30%, 30% teaching, 30%, 33%, 30% teaching, 32% research, and 33% clinical service. So the university normally will that's why we don't do clinic every day. So for example, for psychiatry, specialists only do 2 clinics a week. So that the other time is dedicated for teaching and research. So we have a dedicated time for research, and we have a dedicated time for teaching postgrad, undergrad. So we have a specific schedule that we divided among ourselves. But I think that is a good advantage because life is again never boring. You don't just see patients all the way, or you don't just teach medical students or master students every day, or you just do research only. So there's always change in appetite. Sometimes you do research, and sometimes you see patients at the same time you teach patient, or sometimes you join together during your clinic. Call the medical student in your clinic. You are seeing patients and also you are teaching, and at the same time you're collecting data, from the patients who are doing research. So you have to wear a lot of hats, and you have to learn to multitask on all these things. Yeah, but I think it's a good mix. So I like this all these 3 things together. Yeah.
I think you have done a great job juggling all these 3 big roles, Prof. I think you have done a really good job. And I
Thank
would
you.
just like to add on to what you mentioned earlier, that actually in Malaysia, we have very few psychiatrists, whereby we actually don't have enough, at least not up to the WHO recommendation. How is the situation like in terms of the distribution of the psychiatrists in rural areas versus urban areas in Malaysia?
Yeah, it's really disparity. Majority of the psychiatrists are in urban area. So UMMC probably have the highest load of psychiatrists in Malaysia. We have 18 psychiatrists. Probably the whole of Sabah probably have less than 15. So so there's disparity in this distribution of psychiatrists. Of course, psychiatrists are more concentrated in big cities like KL, Penang, JB, and rural areas like maybe in Muka, in Sariki, in Kapit, probably only 1 or 2 psychiatrists, or in Ulu Tembeling, probably no psychiatrist. So still the area we are progressing. Most I think in Ministry of Health we have at least 45 hospitals with psychiatrists. Okay, at least there's 45 hospitals with psychiatrists. So it's not too bad, but things can get better hopefully in the future. But still, the majority of the psychiatrists in big cities, and hopefully by the time you all graduate and take up psychiatry, things can be better. And I hope I'll be able to inspire more of the medical students to become psychiatrists in the future. Of course, previously it's much worse. When I joined psychiatry, the applicants is only about 3 to 4 per like for UM. My batch, only 4 of us applied. Out of 4, only I graduated. Okay, that's how bad. Okay, but now we all for the past 5-6 years, we always for UM the intake is about 15 candidates per year, 15 candidates of master students. So it's major leap. The number is really increased from 3 to 4 to now about 15. So people are showing more interest now.
I think that's a very positive thing to hear, Prof, because I believe that everyone, despite, regardless of where they are, they should have access to mental health care. And I hope to see more psychiatrists out in the country, like what Prof said. And I'm very sure you have and will be able to inspire more medical students to take up this specialty. Because as you mentioned earlier, data psychiatric patients have increased tremendously over the years. So based on your experience, have you observed any specific condition that seems to have an increasing trend since you started practicing?
Okay, I think that the mood disorder is getting more and more. Patients like depression, anxiety disorders are getting more and more, especially among the youngsters. At your age, medical students' age. These are the transition between teenagers to adulthood to maturity. So there's a lot of stress. There's a lot of changes in life, demands in life occurring now. You have to study, you have to work, you have to get married. And there's competition, and as the life becomes more demanding, technology goes higher, the stress levels goes up. So there's a lot, and there's also a lot of personality disorders developing, because now there's lacking in terms of family cohesion, family bonding, communication. So now we instead of talking face to face, you talk like online like this. You WhatsApp, you Instagram, Snapchat, even Facebook is like old people's thing. So there's a lot of changes, I think, and that trend also, stress goes up, support system goes down, a lot of cyberbullying, drug dependency. So these are some of the new things that have been coming up now. Yeah, especially the mood disorders. Mood disorders are definitely on the rise.
Yeah, Prof, I think a major factor behind that is definitely due to the COVID-19 pandemic, and we see a rise of the psychiatric cases that we have. Perhaps I think the audience now must be very curious about what other students can do, in order to specialize to become a psychiatrist. Perhaps, Prof, you can share with us your journey after the medical school. How did you continue and become a psychiatrist then?
Okay, the pathway, I'll probably say what is happening now. During my time is probably not so relevant. Okay, the pathway, after you have finished your MBBS, then try to get psychiatry as one of your posting during housemanship. So that will sometimes quite difficult because the demand is quite almost always there, but try to get psychiatry as one of the posting, because during the interview they always ask for experience. It's not mandatory, but having a good experience in psychiatry, at least doing a 6 posting in psychiatry, will be very good. And if you have the chance, then during the medical officer time, try to also apply, at least doing psychiatric posting, because again, then depends a lot of your luck as well. Sometimes you apply, but they send you to other posting. If you have the chance, try to attend whatever seminar or online or whatever CME, either during housemanship or medical officer. You're really interested in psychiatry, even though you are actually not posted in psychiatry posting. Let's say you're posted in pathology or posted in anesthesia, but you still want to do psychiatry. So all the CME program that, let's say MMA, National Medical Association or National Psychiatric Association or whatever association conducted, then you should try to attend and get some proof. So at least when you attend the interview, you see, I never have the chance to do psychiatry, but psychiatry is my passion. Even now, I'm doing orthopedic MO. I still attended talks on depression, on schizophrenia, on stress management, on suicide prevention. So try to get all this at least, so it shows to the interviewer that you really have the passion. If you have the chance involved in any research, even you have collect data, or you're good in writing case report, manuscript, and try to publish something. Where doesn't matter, in the newspaper or journal will be very good. Some journals can be very easy to publish. Nation Psychiatric Journal accept a lot of case write-up, because medical students have to do case write-up. So if you find something interesting, then try to publish some case write-up. Let's say three or four of you write about a case write-up about interesting case and try to publish. Publication will stay forever. There's a proof that you publish somewhere, or write in the newspaper article. Stress as medical students, personal experience, something like that. Publish in any of this either online or mainstream media. So at least that's show proof that you don't have the chance to do psychiatric posting, but you have this passion and you do research, or you write up something and you attended courses. Of course, if you want to apply for the masters, you need to sit for what you call MEDSOC exam. This is not just for psychiatry. Any master's course, you must sit for this special exam, like a qualification exam, just like your English test. Not test, MUET, right? Okay. Just like your MUET, you have to, before you enroll into a public university, you have to sit for MUET. Before you enroll into a master's degree in a public university, doesn't matter which specialty, you have to take this MEDSOC. So for psychiatry, you have to take this MEDSOC. Normally, it is valid for 3 years. Okay, so you sit now. If you pass that exam, so it values for the next 3 years. There's also a parallel pathway for the membership. It's called MRC Psych. But that is not very structured as compared to the master's degree. So I strongly encourage you to take the master's degree, which is more structured by the local university. The MRC Psych is by UK, and you have to study on your own, and it's not very structured, and it's more expensive. You have to you take the exam and probably fail a few times, and sometimes the exam you have to go to overseas to take it. So it's better to take the local master's degree.
Yeah, so Prof, I think the important thing for the candidates to have a higher chance to get to master program is to, do more research, write articles, and attend the relevant seminars. And if best, we can get a posting during our HO and also MO-ship. And just now, Prof, you mentioned that in order to get to master program, you need to sit for an interview and also a MEDSOC exam. Is there any other criteria for us, to enter the master program besides these two?
You must get a good KPI, your SKT. When you work, later as a houseman or as medical officer, you'll be assessed by your boss. So you must score at least 85 and above. Okay, so and you must get a good referee report from your specialist as well. So 3 years SKT must be above 85. So you must behave, must do your work properly. I don't think you have any issues with that. Most of you definitely will score more than 85 if you do your work properly. You have a good attitude.
Yeah, Prof. And just to give a picture to our audience, is it very competitive for the candidates to get into the master program? Like seeing that the success rate of actually passing the interview and the exam.
I think for local graduate, graduate, very high chance you can get. Our quality is still very good. So far, graduate, I've never seen being rejected yet for psychiatry. Just to give a perspective, normally about 80 to 100 candidate will apply for psychiatry every year for the national program. We have one called conjoined board where we do the national intake. So normally around 100 to 80 applicants, and we take around 60. But this is not just from like from other university, from Russia, from Egypt, from UK, from Indonesia, everywhere.
In Malaysia itself, besides does any other university take up like psychiatry master program?
Yes. We have University Malaya, of course. We have University Kebangsaan Malaysia, UKM. We have USM, University Science Malaysia. We have UPM, University Putra Malaysia. We have UITM and UIE. So we have 6 universities, but all this are under conjoined board. The exam will be the same. So we set the same question. Even the MEDEX, the interview will be conducted by the conjoined board. The selection also will be done by the conjoined board. The exam also is a central exam. The question will be the same for all the 6 universities. Theory exam will be the same. Clinical exam also is a central. Normally we take turn. So that this year we do exam in next year we'll do exam in USM, then go to UPM, UIA. Okay. This is also applicable to other disciplines as well. It's not just psychiatry. National curriculum. So no matter which university you enroll, the exam, the question will be the same. And but the training will be at separate university.
Yeah, I see. Prof, just now earlier you also mentioned that actually we are quite lack of number of psychiatrists that Malaysia have, that we only have 433 total number of psychiatrists. So how much more do you think we need for the future of Malaysia in terms of number of psychiatrists?
Ideally, it should be 1 to 10,000. So you have 33 million. You should have 3,000. So there's
a lot.
A lot more. You still need a lot more. So there's still a vacuum. So we still can take a lot of psychiatrists. So even if you go to private practice, you can still make a lot of money.
I see.
Not just
Thank you, Prof. Yeah. Yeah. Besides the general psychiatry, may I ask what are the available other subspecialties in psychiatry, and which one is the country is actually lacking the most?
Okay, good question. Psychiatry, there's general psychiatry, there's also a lot of subspecialty. So there's a lot of other subspecialty. So you can have what they call addiction psychiatry. So this deal with with all this drug addiction, internet addiction, gambling. So heroin addiction, methamphetamine addiction, ganja addiction, control addiction. So basically, this is addiction psychiatry one. We also have community psychiatry. So community, they work in community, more of like psychosocial rehabilitation, promoting mental health, seeing patients in the community. So this is another subspecialty, community psychiatry. We also have child and adolescent psychiatry, where you specialize in looking at young patients, less than 16 years old, or 18 years old and below. So we look at like autistic disorder, adult attention deficit, hyperactive disorder, dyslexia, learning disabilities. Even you can have depression, psychotic illness at young age. So this is child and adolescent psychiatry. We also have old age psychiatry, they call it, geriatric psychiatry. So looking at above 65, so like dementia, depression is also more common among elderly. Okay? Organic psychiatry. So these are geriatric psychiatry, old age psychiatry. You have what we call liaison psychiatry. Liaison psychiatry normally works in the general hospital. So these are looking at patients with physical illness who have mental disorder. Okay, example, if you have stroke, the risk of stroke patient developing major depression is very high. So probably more than 1/3 of patients have stroke will develop depression. Of course, you have paralysis, weakness, everything. You can become depressed. Or you have SLE, you can have lupus psychosis. You have hyperthyroidism, thyroiditis. You have a lot of psychiatric presentation. Diabetes, or they will be consulted on patient like organ transplant, organ donor, organ recipient, okay? Suicide case. All these are actually under liaison psychiatry. So this is psychiatrists who consulting, giving consultation to physician with for those who are in medical ward, in surgical ward, in orthopedic ward. So these are liaison psychiatrists. You also have psychosexual psychiatry, specialized in sexual disorder, erectile dysfunction, premature ejaculation, all these pedophiles, voyeurism. So there's a lot of other subspecialty. You also have like psychotherapy, which is focused on we call talk therapy. So there are various types of psychotherapy. So you have cognitive behavioral therapy, you have psychodynamic, you have psychoanalytical, a lot of different types of psychotherapy. You can go into subspecialized, or you can do what we call psychopharmacology. I'm doing in psychopharmacology. We focus more on medicine, drugs, new drugs development, doing a lot of clinical trial. So treating patients, focusing on new drug medication development. So these are some of the subspecialties. So coming back to your second question, which are lacking? All are lacking. We don't have enough. All are not enough. Yeah. Because like child psychiatry in PPM, we only have 3 child psychiatry, but the case load are, so if you have a new case, we probably have to wait 3 to 6 months to be seen because the waiting time is so long. Addiction is a huge problem in Malaysia. We have 3 addiction specialists in PPM, but you see the numbers of patient count with methamphetamine abuse, alcohol. You go to the school, you see the number of cases of ganja or marijuana abuse is a lot. Even in school, in university, there's a lot of this problem is rampant. So you need a lot.
Yeah, there's a lot of subspecialties that Prof has mentioned, and we are lacking in each and every of the subspecialty.
Yeah.
So can I just confirm, like, how do the students actually continue their subspecialization after their master program, and how long it will actually take for them to get the subspecialty?
Okay, so master's degree you need 4 years. Okay? Master degree is 4 years. So normally, after you join the master degree, the exam is normally there's 3 part 1, part 2, and part 3. Just like your MBBS also, first professional, second, and third. So the most difficult one is during the part 1 exam. Because part 1 exam, you have to relearn a lot. You have to learn about neuroanatomy, neurophysiology, neurochemistry, neuropharmacology, statistics, of course, psychiatry, ecology. So that's a whole list. I don't want to list because I don't want to put you off. You have so many things to learn. So part 1 is the more difficult. So there'll be like a filter. But so far, most UM graduate, MBBS, UM, I've never seen anybody fail yet because UM have a very good training. I never seen curious, I've never seen any UM graduate fail in UM itself. So I think all of you can easily pass this part 1. Okay, part 2 is more of clinical exam. So you do a lot of postings, all this subspecialty posting that I mentioned, you have to do. One more subspecialty is what I call forensic psychiatry. Forensic psychiatry is also very interesting. So you break the rule, you break the law, and then you kill somebody, and then you don't want to be hanged the gallows, then you plead you are insane. Then you will assess to forensic psychiatry, and probably we have to stay in a mental institution for life. So that's another area of subspecialties called forensic psychiatry. I forgot to mention just now. Okay, so part 2 exam for the master is more of clinical exam. You also have to do neurology posting. So, and part 3 is more of thesis and dissertation. So you have to do a research and submit your thesis. So once you pass, you have to go through gazettement. You have to go gazettement normally between 6 months to 1.5 years. After that, you can start doing subspecialty. Either you do a PhD, minimum 3 years, or you do like a fellowship program, also normally around 3 years. So by that time, you're quite old already.
Yeah, so it will take around a total of 7 years to get a subspecialty.
Yeah, but 7 years, but in between you have to work first. After you graduate, you have to gazetted and at least 6 months to 1.5 years, and then sometimes depends on the scholarship you have to queue. So yeah, best case scenario 10 years.
I see. Okay, Prof.
I think Prof has outlined the pathway very clearly, and although it might seem like a very long path, but I don't think you regret it, do you, Prof?
No. It's a learning very good. It's a enjoyable process. As you become more senior, things are getting easier and easier because things have become narrow and narrow. Medical student, you learn everything. You learn psychiatry, orthopedic, surgery, ONG, so many things you have to absorb. But once you specialize, you are very focused. So things you have to read becomes very, very easy. And as you practice, like medical students, it's difficult because you just do a lot of theory. Even you do clinical work, it's just observing. But when you do masters or subspecialty, you are hands-on. So it's easy. What you do and what you read comes hand in hand together. So like prescribing medication, it's just to memorize the name of the medication, the dosage, everything. Impossible to remember because you are not doing it every day. But once you see patient, you write it, you prescribe, you see the patients having side effect, you see the patient's improvement, you see the effect, then it becomes easier to remember. So as you progress, it's become easier and easier. So the most difficult to study is actually MBBS. MBBS is the most difficult. Once you can graduate from MBBS, UMMP, University Malaya especially, you can do anything. You can do any subspecialty that you want, definitely. So don't worry.
Understand. Thank you so much for the words of encouragement, Prof. It really helps.
Because I'm from UM, so I've done a lot of from my experience from MBBS until masters until PhD subspecialty. The most difficult exam is the MBBS. The rest is easy.
I see, Prof. And I think just to add on to what you have mentioned earlier, it takes quite some time before you can actually complete your subspecialty. So I would just like to ask, for your based on your experience, how is it like juggling between your work, your family life, as well as your commitments outside of work? I would say throughout your career as a psychiatrist, how has your work-life balance been like? And were there any challenges in order for you to attain the ideal work-life balance?
Okay, being a psychiatrist, the work-life balance is phenomenal. It's good. You want a good work-life balance, be a psychiatrist. Why? Because when we treat patient, we advise you have to balance your life and your work. That's part of life. Is not just studying, not just working. So I value very much family, spirituality. So we have to take care of your physical health, social health, mental health, spiritual health. So you must have a work-life balance. It's very important. So in psychiatry, you see all the psychiatrists in PPM, they all look happy. So they have very good work-life balance. So yes, of course, work is very important. You can be very busy, you can stress at work, but you must always allocate enough time for yourself, for your family, for your spirituality, for socially. So even now, all of you must have good study life balance. Of course, I don't say study less and enjoy more, but allocate time for yourself. Okay, don't forget to call your parents, to talk to your siblings, to exercise, to eat properly, sleep properly, pray to God. So this is very important. Time management, manage time properly, get a good friend, close to your family, then you'll be okay. So it's very important. Work-life balance, very important.
I understand, Prof. I think work-life balance for both people in the working force as well as students, it actually affects the quality or the productivity of the students and the people in the workforce themselves. And I think I have something interesting to ask, Prof. I think earlier Prof brought up the issue that psychiatrists are slightly different compared to other specialists, whereby you are unable to share with your friends or family what type of patients you need on a day-to-day basis, or what are the conditions that your patients are suffering from, and this is because of the doctor-patient confidentiality. So because of this, there's actually a stigma surrounding psychiatrists, that a psychiatrist's mental health is affected when they are dealing with patients. What is your opinion on this, Prof? And if have you ever faced any situations whereby it has affected you, and how do you overcome it?
Okay, just like any specialty, the physician can be affected, but doesn't mean that if you treat schizophrenia, you become schizophrenic. Or you treat patient with mania, you will go back, you become manic, or you treat depression, become depressed. Of course, human being sometimes is, patient committed suicide, you feel sad. Just like oncologist, the patient died, it can be affected. Pediatrician, or cardiologist, see your patient die. You as a human being, it can affect you to a certain extent, but of course you have to deal with it. Being a psychiatrist, you must be able to deal with you yourself must be able to cope with stress. So that's why I think the work-life balance is very, very important. So you have to deal with stress, and of course, as a psychiatrist, you already learn. You every day you teach your patient how to deal with stress, how to cope with stress, how to get support, how to have a good adaptive way of dealing with all these issues and problems. So what is important? You yourself as a psychiatrist practice what you preach and what knowledge you have. And there's one more advantage of being a psychiatrist. We are given extra leave. For psychiatrists, we are given 14 days leave extra. We have hazard leave. So I have a lot of leave. My annual leave is 35 days. I have hazard leave extra 14 days. Then as a medical lecturer, I am entitled 16 days of conference leave. Then I can take 3 months of research leave. So every 5 years, I can take 9 months of sabbatical leave. So there's a lot of leave. So during leave, you can go to conference, you can travel, you can go for holiday, spend time with your family, chit chat with your friends, have teh tarik, the mama store. So that's how we we cope with life.
Yeah,
Go and
I think
exercise.
yeah, I think it's very nice to be able to have a lot of leaves, and definitely one of the important things is to be able to take care of ourselves and our mental health, our work-life balance, in order
Yes.
to. Yeah. So maybe, Prof, I think we have several questions in our comment section. Maybe you can move
Okay.
on to take some of the questions. So we have one question from our medical students as well. Like, does taking the MRC Psy gives you an advantage in applying for the master program?
Yes. If you have this part, you pass either part A or part B exam, you don't need to take the MEDEX. So you have MRC site, definitely you have advantage of higher chance of getting into the masters. Yes, but you have to pay first line. The fees is not cheap,
So if they get
For
part one and
MEDEX,
part
more.
two,
Not necessary lah. It's not necessary. But you have part A or part B. This is just part one. Part one is part A, part B. So you pass either one, then you probably can be exempted from the MEDEX. But I think it's more expensive than the MEDEX. Just try the MEDEX. Why you want to waste time and give UK government money? Dalam Malaysia punya economy not so good. But yes, it can add an advantage.
Okay, thank you, Prof. And we have a second question. Like, Prof, you mentioned about the psychiatry field in urban and rural areas, and I'm curious, are there any differences between the working environment and also the types of psychiatric cases seen in urban versus rural settings?
Of course, there's difference. Urban will be more busy, more cases. But rural, okay, there's of course advantage and disadvantage of both. Okay, for rural, normally you'll be alone. But normally after graduation, they would straight away send you. After gazettement, you'll be sent to rural, but you must be able to practice independently. In urban, you'll be more busy. You're working under somebody, but any problem, you can always call your boss, your HR department, your consultant. But in rural, you are the one. You are the boss, so you have to handle whatever issue. We have to decide. Example, if you work in rural, let's say COVID pandemic, so the hospital director, let's say you work in small hospital in Slim River, for example. You know where Slim River? It's somewhere in Perak, or a small hospital in Bentong, in Pahang. So the director will say, okay, Dr. Priyanka, now we have a COVID pandemic. I want you to set up a psychosocial or PFA, first aid for our healthcare frontliners. So you have to do it yourself, and whatever experience you gain, so you have to do it. Or I want you to organize a stress management workshop for all the nurses, for example. You have to be able to work independently. In a urban area, big hospital, busy, but you have somebody to, in case you want to have issues, problems. In terms of cases, probably slight difference. Depends. In certain areas that you work in the border area in Kelantan, there's probably more of stimulant abuse, for example. You work in Sarawak, sometimes there's more of glue abuse, hidugam, so it depends on the locality as well. Certain rural areas probably more issue like lata, amok, which you don't see in urban areas.
I see. Okay, Prof. We also have a questions on COVID pandemic. Has there been a change in the way you practice psychiatry during the pandemic? And also, is there a change in the type of patients you see during this pandemic as compared to before the pandemic itself?
Okay, then of course, the pandemic have changed a lot with the infection. This COVID-19 is highly infectious. The sometimes face-to-face consultation is difficult, you know. Let's say, so we have to restrict a lot of service. We have to scale down our service because of this social distancing. So patient access becomes more difficult. Even admission also, we have to have a special room. We have to have the swab taken just to cater for this, to prevent infection. And because of this pandemic, and we also have to set up this PFA, psychosocial first aid, for our frontliners who is affected by this pandemic as well. You know, so we have other added responsibilities to cater for our frontliners as well. And we also see a lot of cases rising because stress level goes up. Obviously, online classes are not very popular, or it's not very pleasing for the students, not just medical students, you know. It goes across the board. All the school students, university students, even the teachers are badly affected because it's online classes. You can see significant numbers of depression, anxiety among students now. So the workload actually, the cases are actually getting more and more. Unemployment, economic issues are a lot. So with this goes up the suicide rate as well. Every 1% increase in unemployment increase the suicide rate as well. You know, so it's challenging time for everybody actually because of this COVID-19 pandemic.
Yeah, we understand, Prof. And also, like earlier of the session, Prof mentioned there's a difference between psychiatrists and also a psychologist. So, like, there's a question here: if a person is stressed, who should they direct themselves? Like, is either to see a psychiatrist or counselor or clinical psychologist first?
If you have stress, you can see which one is easier for you, which is available. Okay. So it doesn't matter. You can see psychiatrist, or because stress is just a symptom. Stress is just a manifestation, just like anemia. Who do you see? You see a surgeon, you see a gastro, or you see a primary care. You know, so it can be. It's not a diagnosis yet, but you think you're not coping well and it's affecting you a lot. Just get help. It can be psychologist, it can be psychiatrist, can be counselor. But the more serious the condition, you will be referred to probably if it's quite bad, then you probably straight away they refer to psychiatrist. Sometimes if the psychologist think this is okay, mild, not reaching to major depressive disorder yet, you know, you are still coping well, then probably they can manage. But normally the more difficult case, so the lowest level is counselor, and then psychologist, then highest level is psychiatrist lah. But psychiatrist service is available to you, then why not just go to see psychiatrist? Sometimes it's more difficult to find psychologists because their numbers are even smaller, and I think counselor is also not easy in PPM, in medical faculty. So do you have counselor? I don't think you have. I think 2 counselors, but it's very difficult to get appointment. It's easier to see psychiatrists than counselors.
Yeah. So for us students or the community, we can go straight to psychiatrists. It doesn't matter.
And doesn't matter. Just go. If you think you need help, just go and get assessment. If the psychiatrist says nothing wrong with you, are normal, go back and study, just read your book. Then okay lah. At least you are sure you are okay. It's okay to request or ask for help. And early detection, early diagnosis, early treatment is very crucial in any kind of illness.
Yeah. Yes, Prof. We also have another question from a student as well. Is there any chance for medical students to be involved in research in psychiatry, especially during their research elective?
Yes, definitely there's a chance. Last time, before COVID era, when medical student comes to psychiatry, what we all psychiatry posting, we have a research component where during the 8 weeks we ask you to collect some data and write a report and can even publish sometimes. But now because of this pandemic, it's not feasible to do that anymore. But like I said, it's not just necessary you have to wait for your elective. You can always, during the posting, you can write something and about case write up and send to National Journal of Psychiatry or JUMEC, or there's a lot of avenue for publication actually. Of course, we welcome, but I'm not sure whether now during this COVID-19, do you still have your research elective posting?
It's not sure yet, Prof. Yeah.
Last year they already scraped it off, kan?
Yes.
I remember last batch they don't have.
Yeah, last batch we don't get it.
Yeah. Before, yes, there are a lot of students come and do research with us. We have at the department psychology medicine research unit. So we do a lot of clinical trial. And if you are interested, you can always approach us, any of these psychiatrists in the department, say you are interested to do a small project. We can always guide you and give you. There's a lot of things to do in psychiatry. It's easy. Normally, it's just questionnaire based. We have a lot of patients in the clinic. We have the highest number of patients in Malaysia. Every year we see about 34,000 patients. So sample is not a problem at all.
Right. Thanks, Prof, for the clarification. We have last question here from Hui En. Prof, would it be challenging for students not taking MBBS to complete the Masters of Psychiatry?
It will be challenging for students not taking MBBS. If you don't take MBBS, you cannot take Masters of Psychiatry. You must be a doctor because you must have an MBBS degree to be a psychiatrist. Without MBBS, the most important qualifier. You must have an SPM. The SPM must be good, and you must have MBBS. You must have MMC approval, because you have to see patients. Yeah, if you're not a doctor, how can you see patients? You have to treat. So you have to prescribe medication, decide doing psychotherapy, counseling. So you must be a doctor. So MBBS is a prerequisite. Without MBBS, you can take psychology, clinical psychology. So you will not become a psychiatrist. You become a psychologist.
I think Prof, he or she is taking the MD. It's also a medicine, like Bachelor of Medical Science and Doctor of Medicine. Yeah.
Okay.
Yeah.
Yeah, you are a medical doctor. Yes. Let's say you are from UKM. I think they have, you call it MD. Kan? USM also MD. Yeah. So, you have other universities as well. I hope I didn't offend other universities just now. Okay, yes. USM, UKM, also you can do masters in psychiatry. MD, doesn't matter, as long as a medical degree. Yeah.
Okay, thank you so much for the clarification, Prof. And I think from the Facebook Live comment section, that is all the questions we have for today. And we have actually come to the end of our session for today. And to all the people tuning in, fret not, there will be more sessions just like what we had today in the nearest future. And please do follow our MEDSOC's official Facebook and Instagram pages, as well as subscribe to our bi-weekly email updates to stay updated on all our future events and activities. And for those that tune in today, please take time to fill in the feedback form for us to improve on our future sessions. As for Prof. Hatim, before we wrap up today's session, do you have any last words for all those medical students out there that is watching, tuning into the session today that aspire to be a psychiatrist like you? Do you have any last words for them?
Okay, I see if you have the interest to be a psychiatrist, I strongly encourage you to join. It's not difficult to be a psychiatrist. If I can be a psychiatrist, all of you can become a psychiatrist. So there's a lot of advantage of being a psychiatrist. So this is very give a lot of self-satisfaction. So you're able to help marginalized people, highly stigmatized people, people in the community scared to treat. These are people no one wants to see. You are able to help them, and when you're able to help them, make them recover, it gives a lot of satisfaction. You give a lot of satisfaction. And with the current treatment in psychiatric field now, you are able to help and achieve complete recovery in most of this illness. The psychiatric disorders are very debilitating if you don't treat or you don't detect properly. But with proper treatment, early detection, and good treatment, patient can recover completely. And again, if you see patient very psychotic and they can go back to work, go back to study, it's very, very satisfying. And in psychiatry, you have very good and excellent work-life balance, So I think you will have a lot of satisfaction being a psychiatrist, and I hope you have the chance and have a pleasant journey, just like what I enjoy.
That sounds wonderful, Prof. And once again, I would like to thank you for taking time off your busy day and joining us in this meaningful session. I'm sure that everyone that tuned in was able to enjoy the session as well as learn a lot from you. Thank you so much, Prof. Hatim, for this amazing session, and thank you to everyone that joined us on their Friday evening. Once again, I would like to remind everyone to follow us on our official Facebook and Instagram pages, as well as subscribe to our bi-weekly email updates to stay updated on our future events and activities. That will be all for today. Thank you so much and have a good night. Thank you, everyone.
Good night. Thank you very much. Sorry to keep you almost midnight.
Uh, These are the links. You can follow us on our Facebook page, our Instagram page, as well as scan the QR code to subscribe to our bi-weekly email updates. And there is also a QR code provided for the Google form or the feedback. Please feel free to give us any suggestions or anything that we can improve on for the betterment of future sessions. That will be all for today. Thank you so much, everyone, for taking time off and joining us. Thank you. Have a good night, everyone. Thank you.